Welcome back, everyone. I am really excited today to have on not only someone that I relatively just met, but I've known of him for a while. It's none other than Dr. Kyle Stanley. So, if you haven't met Dr. Kyle Stanley, he is a leading figure in dentistry, recognized as the next generation of cosmetic dentistry by the American Academy of Cosmetic Dentistry and one of the top 5 young educators in dentistry by the Seattle Study Club. His advanced training in dental implants completed in Brazil. Brazil? Wonder what's down in Brazil. Maybe we'll have some conversation about that, my friend. And his extensive contributions to dental research have solidified his reputation. A co-founder of Pearl, which I know a little bit something about that company, so we'll probably get into that. A company valued at over $450 million, Dr. Stanley is at the forefront of dental artificial intelligence, revolutionizing patient care. He's also a mental health advocate in the field, which is probably right. He's on my podcast because I've seen a lot of his posts. If you haven't, follow him on LinkedIn and other platforms. It's pretty awesome. With his Lightside Academy, helping dentists combat burnout. Dr. Stanley's a sought after speaker, sharing his insights on 6 continents and continuously shaping the future of modern dentistry. And why, Kyle, why have you not been to the 7th continent to share all of your experience and expertise? That's the first question.
Yeah, that's next. We gotta schedule a big symposium down there.
Uh,
Grab your
Antarctica,
jackets
here we come. The Two Sleuth podcast on the road with Dr. Kyle Stanley
in
from
Antarctica.
up. You got to tap the 7th continent, man. You got to hit all 7. I'm really excited to have you on this show. And, you mentioned Brazil, and many of my regular listeners will know that I was an early employee of Neodent before it came to the US, actually, when we got ready to launch it here in the United States as part of the Straumann Group. So if you trained on implants in Brazil, you have to, I'm guessing, am I right?
Yeah, I mean, we use 2 implant systems. We use Scene, which is another Brazilian company, and we use Neodent. So I was probably the only American first trained on Neodent. This was back in 2010. So this was a long time ago before Neodent was what it is now. But yeah, I remember coming back from Brazil and hearing, oh yeah, I heard Straumann's going to buy Neodent. That was like a big deal.
It was a big deal. They made that investment. It was late 2013, and we launched the brand in early 2014. And, I'd like to say that the rest is history, but there's a long history with myself and with that brand as part of Straumann Group. So how exciting is that? And, we Curitiba, right? If you've been there, right to the factory, I think it keeps doubling in size. Like if you blink, it doubles in size because of the expansion of the brand. And it really is why I'm in the lane that I'm in today in fixed full arch, because of when it you might get a kick out of this. I get a kick out of it. When we launched in the U.S., because of the way that dentistry is done in Brazil and in many other parts of the country outside of the U.S., when we launched, we did not have an indexed fixture level impression coping. So how are you going to do singles? You're going to send it to a lab and say, make a jig for every single implant that you're doing. So for the first 6 months, it was, well, looks like we're going after full arch because that's not going to work. And so we kind of leaned and left and turned left into that realm instantly. And the rest is really history, knowing that, with the connection and with everything about the implant, it fit well in that space, in that treatment modality. And that really was the beginning of the 10 and a half, 11 years that I've been focused in fixed full arch. So tell me a little bit about your experience with the system that you have from your perspective, since you actually got exposed to it and learned on it even before I was exposed to it.
Yeah, I mean, it was my favorite implant when I was in my residency. We had 2 choices, really, both Brazilian systems, and I loved it. I got good results from it. I mean, we had a good time with that system. Again, this was, gosh, 14 years ago, so things were different, especially in Brazil. But Brazil is very forward thinking in dentistry. I think the average American thinks that dentistry is leading in the US, and you go outside of the country and you realize, holy crap, there are people in other countries that are way better than us. I mean, way better than us. And everyone told me I was crazy for going to Brazil. They're like, Brazil? Why would you go to Brazil? I'm like, Dr. Brandemark teaches in Brazil 6 months out of the year, right?
Right.
Back then when he was alive. And they were like, wait, what? Brazil? So, that helped me justify moving around the world to do my implant residency.
Yeah, so the egocentric American construct, right, that we have, that oh, if it doesn't happen here, it's not happening anywhere. And you're like, just expand your mind a little bit. Like, just get outside of whether it's, on like mission trips that I've done outside of the US that really opened my mind and helped me to become grateful for everything that I have. Like, turn on a faucet and you have running water and hot water and electricity that's consistent. So we can do something like this, right? A podcast platform virtually, or on the other extreme, where you're really learning that there is technology and exploration and other that is just so massively advanced outside of the US in many different fields. And that leads me into the next part of the conversation I want to talk about, which is Pearl. Right. So I've met Ophir Tans on a number of occasions, and I have to admit, like, I did not know that you were a co founder of Pearl. So, how fun is that? So, tell me a little bit about that story, because that's got to be fun.
Yeah, that's a fun one. So Ophir, who is one of my other co-founders, along with Cameron Carter, um, Ophir is a patient at my practice, and he came to me during a hygiene check and said, I have this AI company that does advertising and media, and I'd really love to explore if there's some problems we could solve in dentistry. Would you like to help me explore that? That was back in 2015. And then so we started exploring that. We incubated Pearl within his previous company called Gum Gum. We ended up spinning the company out in 2019, raising our own round of financing. And the rest is history. I mean, the company is now in 120 countries around the world. It's being used by thousands and thousands of dentists around the world. It's valued over $400 million. So it's it's been a success, and it's been pretty fun as well to really be leading that area of AI in dentistry.
So I have a pretty diverse listening audience. So there's some clinicians, there's some that are clinical, right? Hygienists, assistants. There's some in the manufacturing space. There's some entrepreneurs that listen. So I have to ask this question. So for someone like you that you talk about being the next generation of cosmetic dentistry. I'm sorry, I don't mean to be dismissive on that, but as a clinician, right? I mean, there is a certain type of person that becomes a clinician, right? That pretty fastidious with their hands, an eye for artistry, patient care, things of that nature. Someone like yourself that has a patient that comes in and says, I have this vision. Can you help me to expand it in dental? That entrepreneur mindset. Because I know there's a number of individuals that are listening, a group that are listening that are entrepreneurs, whether it's early stages, I don't want to say middle stages, late stages, but more developed, if you will. But, like myself, how is it that someone like yourself can see that, hear that, and actuate on it, and then run with that idea to the point of, yeah, then let's spin this off, and then now suddenly it's in 120 countries? Because when someone hears that, someone like myself, a business that's now valued at over $400 million in 120 countries, it doesn't sound attainable, achievable. So walk me back to the beginning stages and what that was like, so that
Yeah,
people can
for me, it
identify
was
better.
more
Yeah, please.
exploration.
Yeah.
I don't like to have regrets. And so I think to a fault, I say yes to a lot of things. And, sometimes that may lead us to our burnout discussion, right? Saying yes to too many things. But I wanted to explore this opportunity and say, hey, is this something that would, help change my profession? Would this help me diversify my profession and what I'm doing? I was already diversified in the sense that I had a private practice, I was doing research, I was speaking, I was teaching at the university. So um, I was doing a lot of different things in dentistry, and this was just one other aspect that I hadn't explored. And I explored it. We explored it for about a year, not really full on, here and there, talking every month or so. And then it became a little more serious. And it was a very big transition. People are always asking me, how do I transition out of clinical dentistry? I mean, for me, it took me 7 years to transition. So it was a long process, but I explored it. We ended up making it work. Not everyone can. Maybe we got lucky. There was a lot of timing involved, but we had the right people involved as well. And it ended up working out.
Yeah, and you're talking about, right, timing is one, but certainly, and you ended with that, it's the people, right? It's putting the right people in place and bringing them in. And I find that with my business, there's a great book. It's called Who, Not How. That is so instrumental of, I don't have to figure out how to do it all, but if I can bring people in that have a certain skill set, and then it goes back to the, even before then, which is list out what the needs are, and can you group and categorize them, and then do you put them into place and say, okay, this is not my skill set, I'm good at this area over here, I'm not in the good at this area over here, and let's bring these individuals together, share the vision, and then let's execute on that, and let's see if there's some there. So I appreciate you sharing that piece of it. And so for my listening audience, because I know for myself and for a number of others, there are other companies that have had significant, investor raise in the space of AI. Right? There's Pearl. There's others. There's Overjet. There's many others that are out there. What is a differentiating factor from your perspective of Pearl compared to some of the others that are out in the marketplace, and the approach to the marketplace for Pearl?
Yeah, I mean, there are other companies. Chris from Overjet is one of my really good friends. We've become very good friends over the years with being on the same panels and writing the white papers for the ADA together. And he and I have become just great friends. So there are other companies in AI all around the world. I think one thing that differentiates Pearl is that we are probably the most international. So we have the most regulatory approval. We are in the most markets around the world when you talk about Asia and Australia and the Middle East and Brazil and the UK and Europe and Canada and the US. And when you think about the long term, what happens with a lot of these companies is you end up partnering with other companies, right? So one of the partners we have is, oh gosh, why can't I think of their name? From Finland, the X-ray company. Oh, again, oh,
Plan
Plan
Mecca.
Mecca.
Yep.
Okay, yeah. So let's say you talk to a company like Plan Mecca, and Plan Mecca comes to you and says, "Hey, we're interested in doing AI." And let's just say you say, "Yeah, we're great. We've got a bunch of people in the U.S." And they say, "Well, that's great, but that's 30% of our world market. Like we're an international company. What about Europe? What about Australia? What about Asia? What about Middle East? What about Brazil? What about South America?" Right? So you really have to be an international company in order to really expand quickly. And I think that's what has gotten Pearl to the point of where we're at. I mean, of course, too, we're probably the only company that has a team that has built $1 billion company before.
Yeah, and that footprint, right, is critically important, and I appreciate you pointing out that differentiation, which is something that I wasn't as aware of, and I think that the analogy, especially with a company like Plan Mecca that has a global imprint, is certainly looking to partner with somebody who does for sure. Well, let me ask you this, because you talked a little bit earlier about transitioning from clinical dentistry out of clinical dentistry, and combating, and you talk a lot about this on your socials, and I see you speaking about this, and our mutual friend Martin Mendelson does a lot of work in this area, right, of talking about mental health or mental wellness, if you will, just wellness in general, and the burnout factor of and I'll say it right, it's probably the most crude thing to say, but trying to avoid being the drill and fill doctor, right, and finding new paths. And it's what I speak on when I'm talking to clinicians that are looking for entering the fixed full arch space, right? So, what is your motivation? What is your why? Because patients look for not the product, the what, but the why, right? Their motivation for finally doing something about an arch, like, why now? Why are they going to do it? And same for clinicians. What is your why? Is it the money motivation? It's okay if it is. Is it that you're bored and you're looking for something new and a new challenge? It's okay if it is. Is it for that patient reveal that's just really can be life changing, right? And that's okay if it is, but at least know what your why is, right? It's to be able to be inspired and avoid that same old over and over. Talk to me a little bit about what you're finding as you encounter. And I think the statistic, I had a guest on very recently that was talking about, well, dentists now are number three of the industries of the suicide rate, which is that's just gross to me, right? I mean, it's a major problem. And for me, and I've talked about this as well, it's like that dirty little secret that everybody's a little too proud. especially in my lane, in the fixed full arch lane. It's all the, oh, I did 20 arches last month, I did 30. And you're like, come on, can we just like, enough with the bravado, and can we just have real conversations? So, what are you finding in all of your teachings, learnings, connecting with other clinicians as they share with you on a more intimate basis, perhaps, about burnout?
Yeah, well, suicide is a real thing. Burnout is a real thing. Depression, anxiety is a real thing. I just got a message today. Unfortunately, I've become the suicide guy in dentistry. So I get all of the messages and texts when practitioners commit suicide. We had one this summer in Southern California where I live. I just got a message today that we had a student on the East Coast that hung herself. Um, and so it is a real thing. There's some studies that show we're 17 times more likely to commit suicide than a non-dentist. We're twice as likely to suffer from anxiety, depression, and panic disorder than a non-dentist. So it's a real thing. Ever since about 2018, this has been a big push of mine to talk about this because I had a platform, I had a following, I was speaking 40 times a year, which I still am. And now that I got pearled to a certain point where I don't really have to be involved that much, just really as a KOL now, that I can really focus on this. So this has become my main focus, is helping our profession on getting better with this. But to answer your question, is that I think one of the main things is that dentists are so used to grinding that they don't know what not grinding feels like. So, for example, in order to get into college, you had to do well in high school. In order to get into dental school, you had to do well in college. In order to graduate dental school and take your boards, you had to do well in dental school. You had to stay there on the weekends. You had to come to night clinics. You had to work your ass off. You had to read. You had to study, all this stuff. And then you get out and, oh my gosh, I got to grind because I need to get this job. And then you get that job. And then you start to practice. And oh my gosh, I got to grind because I got to clean things up and I got to organize the office and I got to raise my production. All of a sudden, it's been 12, 15 years that you've been grinding. You don't know what not grinding is. And so now, if you think you have to grind, you're in a hyper grinding session. You're not even normal grinding, you're in a hyper grinding session. And I'm a car lover. I love cars. So I always relate this back to cars. You wouldn't get a new car, put it in first gear, and rev it to the red line forever and think that it's just going to last. And that's what most of us do. And so many of us redline our career forever until we burn out. And I see that all the time. I have dentists in my masterminds, my online programs, my in-person programs that I do with Martin Mendelsohn, for example, and they've burnt out. They love this profession more than they love their wellness. It becomes an obsession. And that was how it was for me too.
Yeah, I've had conversations with clinicians, many. I'm in recovery, have been for 19 years, and have an addictive personality, and it'll transition from the chemicals, the substances, to you name it. Right, I can go right down the list. I can take anything to the extreme, and that includes like throwing myself into my business. So I want to ask you, and they've shared openly, and it is those that reach the top and the pinnacle of their professions that have that tendency toward, because they're very driven, and finding that balance of how do you find that balance? And so I want to ask you this question, because I don't know if anybody else picked it up. Maybe some of my listening audience, they'll pop it on socials if I don't ask this question. What you just shared was, I speak 40 times a year and I still do. And my first thought was, and how do you find balance so you don't burn out? Because I can share with you that I travel a ton, whether it's to visit with clients, to do speaking engagements, to fill in the blank, go to conferences, and continue with the networking to continue to grow my business. And I can tell you that I know that I have to have things in place, and I know when it's getting beyond my, not control, but it's getting out of balance for me at times, and others recognize it. So what is that like for you?
Yeah. So 40 times a year for me, um, that's probably 30 traveling days. Okay. So not 40 traveling days, because some of those are webinars as well. But remember, I don't practice anymore. So when I'm not speaking, I'm at home. I'm relaxing. I'm not running Pearl anymore. So you talk about working, 80 days a year. It's not that much.
So that's, I mean, that's that sounds like an idealized life.
Yeah.
There's people that are listening that are shooting arrows at you right now, being
No, I
like,
mean, it
we
was it
want
was
that life.
crazy for me
Yeah,
when I was speaking 30 times a year and practicing 4 days a week and starting Pearl and doing research and being at the university. Like, that was wild. Now
yeah.
it's fairly easy.
That's
Yeah.
the and that I think probably a lot of my listening audience can identify with more, right? That are in it, right? And in the thick of it, right? So you can identify with that. And so I think that
I was
when
there.
people can identify, yeah, when people can identify with that piece, they tend to be able to understand better. And that's, I was drilling at that, not so much being over the crest of it. You can look back on what it's like now where, oh yeah, I'm working 80 days a year. I think everybody just kind of went, this guy. No offense. I'm sure you've earned it, but I'm sure that I know for a fact, 'cause I know that's what I thought when you said that. I'm like, wait, you're literally working 80 days a year? All right. I want that kind of life.
Yeah, I have meetings here and there, and I advise 10 different tech companies as well. So it's not like I'm not working on those other days, but I'm not treating patients or I'm not traveling. So I'm doing phone calls and emails. And what I realize, and what every dentist will realize if they ever do anything else, nothing is harder than treating patients. Like, doing business and having all these meetings, so fucking easy. It's so easy. I hope I'm allowed to cuss here. So easy compared to treating patients. Treating patients is so hard. It's physically hard. It's mentally hard. It's emotionally challenging. But what I didn't realize was that my communication wasn't great. It was all these soft skills. I was a great dentist. I was a pretty good clinical dentist. What I wasn't good was setting expectations. I wasn't good with boundaries. I wasn't good with communication. That was what led to my burnout. It actually wasn't working so much. It was working so much and not having the soft skills.
And those are applicable not just in business as a dentist and working in your practice. I mean, these are like universal, right? If you don't have the boundaries to be able to say no or carve out time for yourself or make sure that your days and your calendar isn't overblown and working while you're on your quote vacation time and putting things in and saying, saying to yourself, I'll never be, and I know for myself, I'll share this openly, and that for myself, because I was steeped in addiction for a number of years until I was in my early 30s, there is this sense of that can creep in easily I don't, if I'm not mindful of it, of I'm trying to make up for lost time. Even though I'm in my early 50s now, 19 years in recovery, it'll creep in of, yeah, but, you got a late start, but even though it's not realistic in this, and you're going to be penniless and homeless and under a bridge in 6 months if you don't fill in the blank, right? Which is so unrealistic on the face of it and the fact of it, but it's that sense of, right? So it's mindset and it's understanding. And so I appreciate you bringing that forward, that because it's hard to do dentistry, right? I don't know what it is because I haven't practiced dentistry, but it's also hard to start your own business because it's the fear of the unknown. It's also fear of success or fear of failure. And then what if I have to drag my butt back into corporate America if you come from the manufacturing side? Or as a clinician, I'm sure it's, what if it's not successful and you have to go back to clinical dentistry and you tried and failed, right? So there's, I mean, I'm sure there's all of these things. So I appreciate that part of the conversation. Well, Kyle, here's the part of the program. All of my listeners play a little something we call What the Sleuth is Going On? 3 rapid fire questions. First
Okay,
thing that comes to mind. Are you ready to play?
let's do it.
All right. Question number 1. What's the worst bad breath you've ever encountered?
Oh, that is easy memory. That is, let's see, we were on our way. That was, I think, our honeymoon. It was either our honeymoon or when we went to
Careful,
Thailand for
divorce
fun.
papers are going to be ready.
Yes. Um, No, it wasn't my wife, of course.
Okay,
It
good,
was
good save,
on
good
the
save.
plane. On the plane, we were heading to Guangzhou in China, and the guy sitting next to us was just horrendous, like extreme perio breath, and that was the worst. And we had to sit there for however long it took to get to Guangzhou, like 12, 14 hours, something. It
Takes
was
a
bad.
while.
Yeah.
I got into the back of an Uber recently, and he was in the back. He was kind enough to put my suitcase, my luggage, into the back, and I got into the back seat while he was doing that, and I could smell the perio breath in the vehicle when I got in. Like,
Oh,
bro, like I can't even tell you. It
yeah.
was
It's funny.
so
Patients are
bad.
always like, "Sorry about my coffee breath," and I'm like, "I like the smell of coffee. I don't know what you're talking about." But then they'll come in with perio breath and not say anything.
And you're like, are you not aware? Like, that's
Yeah.
just bad. Okay, question number 2. If you could change one thing about your smile, what would it be?
I am changing a lot of things about my smile. I had orthodontic surgery last year for sleep apnea. So I've had a 2-piece maxilla, mandible, and maxillary advancement. I'm finishing ortho right now. So, I mean, if you talked about right now, I'll be closing some spaces and doing some little composites with my business partner, Matt Najad. So that would be my own smile, but I'm
I'm
almost there.
shaking my head at you. I'm just shamelessly shaking my head at you. For those who are just listening on the podcast, the watermark is like at the 25.5-minute mark. Go onto YouTube and look at this guy's smile. Smile forever, like pal. Just do it. Like, he's got a great smile. So, like, I don't know what his
I have
issue
my
is.
praise in
Like,
right now.
yeah. Oh, okay.
Well,
Well, all right.
I
Maybe
may have
that's
a
it.
good smile now because I went through
You went through hell and
6
back.
years of orthodontic surgery.
Okay, all right.
So
Well, it's worked.
pretty
Yeah,
good.
you got a good smile. All right, all right. Well, I
Thank you.
said now, right? If you could change one
Yes,
thing about
now,
your
yeah.
smile right now. Yeah, I didn't
Mhm.
say, but okay. All right. Just for clarification purposes. We want to be accurate on the Two Sleuth podcast. All right. I don't know. Question number 3. I told you it'd be a crazy ride today. Question number 3. If you could go back and be the inventor of any dental product and no, you can't choose your own, which one would you choose and why? The pensive look on his face is amazing.
I think I'm gonna be a little selfish here and say that I'm happy that I brought this idea of education in mental health to our profession. There's nothing more powerful, I think, that I could have put time and effort into. Is it an invention? No, but I'm one of the first people to openly talk about it with a fairly large audience. So, gosh, I was trying to think, like, what would it be? I mean, if I look back on it, maybe implants, like, that would be cool too. But, you're impacting billions and billions of lives. But I think from a profession standpoint, helping the profession move forward, it's what I've been doing since 2018, which is being open and vulnerable about the challenges that dentists face mentally.
Well, and I can appreciate that because I talk a lot about, I think you're episode 80 something on the Two Sleuth podcast, and I talk about vulnerability on the Two Sleuth. I talk about being very open on this show and allow people to be, and people tend to be that on this show. And what you're talking about is maybe not so much the volume of impact of number of individuals, but the fact that you're changing the course of the conversation in the industry that's so desperately needed. And so,
Yeah,
and
it's
I can
things that I
appreciate
never
that.
thought that I would hear people say. I mean, one of someone who's become my good friend, she started off as one of my students at USC when I was teaching there. She ended up taking my Lightside Academy course. She messaged me the other day and told me again, she's told me this multiple times, that I saved her life. She was literally thinking of jumping out the window. And she took my programs, she changed her life, and she's so happy now. I mean, she went from complete burnout, suicidal ideation, to thriving in dentistry. And that's so much more powerful than AI or what I used to teach people, mostly about implants and smile design. I still do, but not as much anymore. There's nothing more powerful that I could do in our profession than that.
Yeah, absolutely. I mean, that's giving back in a way that isn't metrics based or KPI based, but I mean, the amount of the ripple effect is just so tremendous, right? You
It's
think of
funny that you
dropping
say
a
that.
stone.
It's funny that you say Ripple because that is the acronym that we use in my course,
Is
which is
it really? I did not
realize.
know that.
Yeah,
Yeah,
yeah. That
listening audience, I
I
really didn't
didn't
know
pay
that.
Greg $20 to say
Right.
that. So the acronym is to realize your problems, identify triggers, find your purpose, and have perspective, learn, and then elevate above that. So yeah, that's
Yeah,
my.
I love that. Recently had on a friend of mine, Chelsea Myers, and she was so just a heart connection instantly when we spoke. And I had that moment when I was really feeling down. It was really difficult. I had a transition in my business that just personally, it was really difficult for me. And I was getting ready to go in and see a client that morning. And I just reached out with a text message, and all she said was, call me. And I called her and just had a brief 5-10 minute conversation. And she just reminded me of my truth in that moment. And it like, the heavens didn't open, the angel Gabriel didn't sit at the foot of my bed, right? It wasn't that. It just shifted like 1%, like an ocean liner. And the direction by the end of the day had changed, and it allowed me to be present for that client, which is what I needed to be in that moment. And the courage it took me just to send that text message was tremendous. And for her to instantly be like, yes, just call me. And it wasn't like it wasn't, it was just her being who she is too. And that's what you're talking about, just being available to other people and having the open, vulnerable conversation. And it takes two to tango in that situation, right? Somebody having the courage to reach out and talk about where they are from a place of vulnerability, and somebody to be there on the other side to say, let me walk you through it. Let me walk through the truth that I know because I've been there before. And that there's something powerful in that human to human connection. So I'm really grateful that you shared that, because that somebody listening today could very well need to hear that, and hopefully they do. So in the last few minutes, Kyle, is there anything that I haven't asked you or that you'd like to share with our listening audience today? I just want to open that up for you to be able to do so.
I think I would just encourage our profession to be more open, to not only show your highlight reel on Instagram, to be real with your colleagues when you see them at study clubs or symposiums. The more we can be open with each other, the less we will isolate some of our colleagues. And when we isolate people and they feel alone and they feel like they're the only ones that are going through something, this is unfortunately when we lose colleagues. So that would be my big my big push for our profession is let's be open, let's be real, let's show our complications, let's show our wins as well, but not just talk about our highlight reel with each other.
I love that. We are human and we are complex. And thank you for sharing all that you have today. And my guest today has been Dr. Kyle Stanley on the Two Sleuth podcast. I can't wait to see you in person here soon, and meet in person and meet you along the road for sure. If anybody wants to get in contact with you, Kyle, what's the best way for them to reach out to you?
Yeah, you can reach out to me on Instagram. It's at Dr. Kyle Stanley, just Dr. Kyle Stanley, or you can go to my website, drkylestanley.com. Same thing, drkylestanley.com. If you're interested in any of my courses, those are on there. My speaking dates. If you're interested in bringing me out to speak at your events, or you're just want to talk, feel free to reach out.
Love it. We'll make sure all that gets into the show notes. I am honored and have truly enjoyed this conversation, and I know my listening audience has as well. Thank you so much for being a guest today.